morning, Virginia. This is Virginia This Morning with Julie Bragg and Greg McQuaid.
It can be an embarrassing problem, and it affects 33 million Americans.
It's amazing, but now there is new treatment for an overactive bladder symptoms. Dr. David Glazier and David Rapp and one of their patients, Rosa Noyes, join us with all the details. Folks, thanks for coming in and explaining to us. 33 million Americans?
Gracious.
Doctor,
Yes,
tell us.
Yes, well, overactive bladder really represents a constellation of symptoms. Urinary frequency, or going to the bathroom a lot, urgency and having to rush to the bathroom, and incontinence as well. And it really does affect about 33 or even more million people.
Men and women the same?
Not really. There are slightly predominance towards women, but we do see a lot of male patients as well, and spanning a lot of different age groups as well.
Rosa, you were affected with the overactive bladder. Tell us how inconvenient that was for you.
Well, at the time, I think I've suffered with this maybe 6 years or so. I have used very thick pads morning and night. I was going to the bathroom maybe 3-4 times an hour, 3 or 4 times an hour, also getting up 3 and 4 times at night, and then when I woke up in the morning, straight to the bathroom. So it has been a terrible inconvenience, and I think I reached the point where I thought I had lost total control of my bladder.
And medications didn't help you, because we see all the ads on TV, this will help you, that'll help you, but that didn't help you.
No, not at all. Well, it did for a little while, and then it would it was like it wore off. And I was pretty miserable.
Yeah.
Doctor, tell us about this new treatment.
The new treatment is it's a nerve stimulation, which we do. We actually stimulate a nerve, believe it or not, right beside the ankle, posterior tibial nerve, and that feeds up into the nerves that supply the pelvis and helps strengthen the pelvis to help us give better control of the bladder.
The ankle?
The ankle. There's a nerve.
That's amazing.
So it's actually very minimally invasive therapy, and I can show you a little demonstration.
Yeah, why don't you do that?
Rosa, do you mind?
Rosa's like, I know how this works.
Yeah. Rosa's gone through the treatment.
So what we do is this. This is the device. This is what it is. We just put a little pad on here. Rosa's had this done many times, and she's really getting a tremendous benefit from it.
Right in the arch of her foot, right
arch
there.
Arch the foot, and then we go 3 fingers breadth above the bone of the ankle here, and 2 across this little nerve there that we usually drop a needle in. And we start up the device. And what we would do is that once the device starts, we'll just kind of tee it up and increase the strength of it.
Is it painful, Rosa?
No, it's not painful. It's no more than just a shot.
That's it.
You know, you get used to a needle, and then it starts vibrating a little bit, and sometimes I get a little tingle. But once it's in place and the procedure is started, I just socialize with the rest of the women.
That's part of the therapy.
How often do you have to do this, and how many times, and will it last her forever, or is she going to need to keep doing this off and on?
What we do, we do 12 treatments, once a week for 12 weeks. You come in, we get this treatment for 30 minutes. What you then do, you get and see how people are responding. Our data is that around 50% of people really do respond very well to this. Sometimes they can stop therapy, other times they need to come back in less frequently and for top-ups, with this therapy. And it works beautifully, and it prevents people from going for much more invasive operations.
Wow.
Doctor, tell us, with 33 million plus Americans suffering from this, it's I would imagine mildly embarrassing, but really it's something that a lot of people are affected.
A lot of people are affected, and one of the very common descriptions that I get is that we all have urgency and frequency to some degree. That's what tells us we have to go to the bathroom. But our patients, their lives revolve around the bathroom. They figure out where the bathrooms are in the mall. They figure out where the next rest stop is. And so their lives are completely restricted. So this is a huge benefit that allows them to sort of regain their lives and go to these events and do these things again. So,
are more and more people learning about this?
More and more people are learning about this and coming forward, because it's not something as embarrassing as it used to be, and it's something that we can do a lot about. So, yes.
What's life like now, Rosa?
Well, life is wonderful. I used to get in the car to leave town, and I'd have to ask my husband to stop, and we weren't even out of town, so it's great. It's great.
It's really fascinating. I mean, when I read the description, I couldn't believe it, and to see you actually do it, it's kind of like Star Trek to me.
It is. It's wonderful therapy. It's so minimally invasive as well, and people, 50% of people can really regain their lives again. It's a huge, devastating factor. People don't go to church on Sundays, don't go to weddings, don't go to out at all, and they're housebound. So it really can improve people's quality of life tremendously.
Doctor, tell us the name of the treatment and how people can find out about it.
Uroplasty is the treatment, and they can call us Virginia Urology, 804-330-9105.
All right.
Make a phone to see Dr. Rapp and myself or one of our partners.
And Rosa, thanks for sharing, because I know there are people at home right now, if it's not them, they know someone who might be really interested.
Well, yes.
Rosa, thank you, and doctors, appreciate it.
Thank you.
Thank you for having us.
All right.